Hey guys, I'm back with another advice video. This one's called General Medical Advice, and I'm going to be helping you guys out with some medical problems you might be having. Hopefully I can help. You know, I'm not just some kook, some quack. I'm a certified doctor. Graduated from NYU in '74, and graduated magna cum laude. I double majored in medics and women's studies. Alright, so let's start things off simple. We're going to talk about the common cold, okay, also known as the rhinovirus. And that's not a joke, you can look that up, that's true. I'm going to let you in on a little secret here, people. The best way to clear up a common cold is to run 5 miles a day. Okay? If you can't run 5 miles, you need to run until you cannot run anymore. Alright? Exercise is essential, okay, for dropping your red blood count. Once you do that, your cold is gone. Okay, chest pain. Chest pain is another very common problem in America, okay? A lot of people experience it. It's caused by a whole lot of different things. Many things cause chest pain, some unknown. And the worst case scenario if you're feeling chest pain is that you might be having a heart attack, okay? And that is no joke. If you're having a heart attack, okay, you're gonna know it right away, because the pain is going to be shifting to the right side of your chest, okay? And shortly thereafter, the entire right side of your body will go haywire. Your right extremity, your right arm, is going to start twitching. Okay, it's going to start out a little slow. It's going to move down your torso, the twitching, and by the time it gets to your leg is going to be going absolutely ballistic. Alright? And basically, if you can drive, immediately drive to the hospital, okay, and have your resting heart rate taken, and they should take care of you. Now, driving can be tough, okay, because obviously your right leg is going nuts, and that's what you drive with. So what you want to do is you want to straddle the center console, stick that crazy ballistic right leg in the passenger seat, okay, and you might as well throw that arm over there too, because that's not going to do you any good. And that way you use your left foot to operate the gas and brakes. Might take a little bit to get used to, but you'll get there. It's not that hard. And yeah, it can be tough, you know, because you're over here while this is going nuts. It's a matter of coordination. So if you trust yourself, get more power to you. Okay, there is one 100% foolproof prevention technique that you can use to never have a heart attack again, or never have one, period, if you have not had one. Okay, and that is to have a pacemaker installed, okay, as soon as possible. The longer you go without a pacemaker, your chances are exponentially increased of having a heart attack. Ideally, you should have your pacemaker inserted before you're 20 years old. Okay, that's gonna do your best. That's what the FDA recommends, and I stand by their judgment. And you know, it's interesting. You can go earlier than that, absolutely. You can go as early, I think these days, as at about 4 years old. But I got some colleagues over at Syracuse University, and they're currently experimenting with inserting pacemakers into fetal children, which is just a miracle, really, if they can get that done. heart attacks will be a thing of the past. And some advice for you guys out there: if you do get your pacemaker, stay away from microwaves. Next set of advice: migraines. Okay, America. What is America? It's the migraine capital of the world. And if that's the case, then New York is the eye of the storm. Okay? We have a high stress lifestyle and we live fast paced. There's a reason they call it the fast apple. We work hard in New York, alright? We're not a bunch of lazy southern redneck hillbilly retards. Now, sure, you've seen all the commercials and the ads in Medicine Weekly for all these migraine pills, all these miracle cures and stuff. Let me tell you right now, stay away. They may be FDA approved, but they're not Matt Clark approved. The very best cure, and the only one that I can put my seal of approval on as a practicing orthopedic surgeon for the past 43 years, is to get a pair of 3D glasses. Okay? No, it's not a joke. 3D glasses. And then you want to get some loud blasting music, as loud as you can get it, as close to your ears as it can go. Okay? And now you are going to step outside and stare directly into the sun for as long as you can. Okay? If your migraine is not cured in 20 minutes, then I don't know, I can't really help you. The ideal situation for clearing up your migraine is if you can get to a concert, okay, with the loud blaring music and stare up at the sun right when you're in the front row with the 3D glasses on, okay? Back in '83, I think, I went to this, I had a horrible migraine, and luckily there was, U2 was playing an impromptu rooftop concert in the Bronx. So I went right there, cleared my migraine right up, best migraine I ever had. Now, migraines are caused by a lack of vitamin D. Your body craves vitamin D. And as we all know, the sun is practically made of vitamin D. Don't have access to the sun? Grab a bottle of Sunny D. Don't have access to Sunny D? Well, start counting your days and numbers. Alright, I know we've been talking about some serious medical problems, but we're going to lighten it up a little bit, and we're going to talk about acne. Yeah, it is a medical condition. Although it's not life-threatening, it is quite agitating. Okay, I'm going to let you in on a little Matt Clark tip. Matt Clark acne tip. Okay, the best and fastest overnight cure for acne is none other than Utz sour cream and onion potato chips, okay? And I know these are salt and vinegar. I didn't have any sour cream and onion, but these are, they're close and they're still good. I can feel it clearing up already. Okay, next we're going to talk about something that everyone gets from time to time, and that is cuts and abrasions. Okay, probably the most common injury sustained all across America. Okay, if you get a little cut, got a little scrape or something, you gotta clean that off. You don't want to risk any type of infection. Okay, and if the pain is just too bad, what you need to do is you need to go down to your local drugstore, buy yourself a syringe and 20 cc's of iodine. Okay, iodine is the world's leading numbing agent. Okay, and what you're gonna do is you're gonna fill up those 20 cc's in the syringe. You're going to inject the iodine 2 millimeters away at a 45-degree angle, and that should alleviate any and all pain for the next 12 hours. Okay, now if you get a deep cut, you might need to get stitches in that. Okay, you might need to stitch that up. Now I know you're saying, Matt, how do I know if it's deep enough for stitches or not? Basically, there's a really easy, simple trick. Okay, grab a penny, grab a penny out of your piggy bank, out of your pacemaker fund, and stick it in the wound. And if Abraham's Lincoln neck is visible, you need stitches, buddy. Yeah, they taught me that penny trick during my residency, and I'll tell you, I used it on just about everybody. Okay, let's say now if the penny goes all the way through your arm and comes out the other side, then I'll tell you this: you're in trouble. Okay, either that or your world-renowned New York Street Museum magician Criss Angel, which is awesome. Now let's talk about stitching it up. Okay, I prefer to self-stitch. Okay, I'm not trusting my cuts in the hands of some incompetent whack job over at the hospital or whatever. You know, I can do it myself, and you should learn how to do it yourself too. Okay, and what I tell people, I have all my students. They practice with sweatpants and a sewing needle and thread. Okay, because this is not commonly known. I don't know why. I've been preaching it for years, but sweatpants are the closest, the material that is closest to resembling human skin. Okay, the more work you can get done on sweatpants, it's like you're sewing up people. Okay, so I'm gonna do a little demo to show you guys how to sew up a cut. Okay guys, let's get sewing. What you're gonna need is some thread, or if you have yarn. I usually prefer yarn. I really only have thread right now, but you got your needle. Here I got my sweatpants. We're gonna call this our cadaver, essentially, just like working on a human. I'm telling you, it's uncanny. Here we have our cut. Now that's a deep one. That's gonna need a lot of stitches. Okay, so here we go. You always want to start north to south. You go north to south. Okay. All right. Here we go. We're in. Okay. We're out the other side. Pull through. And you go. Okay. Now what some guys do is they pull back over. Okay. I like to go over under, like so. Saves energy, saves time. Gets you a nice stitch. Alright. Now, we'll go back over. We'll double it this time. We'll go through both. Boom. Here we go. Okay. Now this is a lot easier when you're doing it on yourself, really. But the sweatpants, they work nicely for training purposes. Okay, there we go. That's three passes. This one will take maybe 20 or so. This is a big one, but you want to practice the way that you play. You practice the way you play, and that makes perfection. Boom, we're in. It might seem slow and methodical, you know, while you're stitching yourself up. I know it's not the most exciting thing in the world, okay? Okay, so we got our final product for our stitching done. Let's take a look. See, here we got our outer weaves, and you can see the left weaves right here. Looks good. It looks real good. This one came together very nicely. Really happy with this one. If this was somebody's actual wound, they'd be stitched up real nice. And the sweatpants are real good, and I don't know if I went over this before, but another reason we use sweatpants is because they actually have healing properties similar to human skin. In a week or two, maybe 2 for this cut, I'm gonna go ahead cut these stitches out, and we'll have ourselves a nice fresh, you know, it'll mend. It mends itself. Sweatpants. Okay, this isn't so much on the advice as it is just a little me venting here a little bit. I want to talk a little bit about this medical marijuana phenomenon that's sweeping the country. Okay, let me tell you right now, it's a crock. All right, I'm getting tired. I'm sick and tired, okay, of these West Coast pot smoking Fruit Loops with their beach chairs and their surfboards, alright? They just get on my nerves. Stop coming to my office with your surfboards, okay? I'm not smoking you up, bro. Okay, we're gonna finish things up here on a lighter note. Something not so severe, but still very common. And that's the twisted ankle, okay? And so if you twist your ankle, you get a twisted ankle, what do? You dunk that sucker in paper mache, alright? Boom, homemade cast. It will feel 100% immediately. You can walk, you can run, you can skip, you can jog, you can even play football, okay? Okay guys, thanks for tuning in. We have reached the end of Matt's general medical advice. I hope I helped you guys out, and I wish all of you the best of health in the future. And don't forget to tune in to my next video, my next upcoming video, general magical advice. Alright, if you want to learn a few tricks of the trade. Peace out.